A lot of nurses reach a point where they start asking the same quiet question. Can I still be a nurse if I do not want to stay at the bedside forever? The answer is yes. Leaving the bedside does not mean leaving nursing. It may mean your nursing skills are ready to be used in a different way. And that is what we are talking about today. Careers beyond the bedside, especially case management, and why this path can make sense for nurses who still want to make an impact without staying in the same clinical role forever. Bedside nursing is important. It is where many nurses build their foundation. You learn how to assess quickly, prioritize under pressure, communicate with different disciplines, educate patients, and advocate when something does not feel right. But the bedside is not the only place those skills matter. There are nursing roles in case management, utilization review, quality improvement, patient education, informatics, population health, insurance, and care coordination. Some of these roles are in hospitals, some are in clinics, some are in the community, some are remote or hybrid. The common thread is this: they still rely on nursing judgment, they just use it in a different setting. One of the biggest reasons nurses begin looking beyond the bedside is stress, and the assumption is usually simple. If I leave the bedside, the stress will go away. But the more honest answer is this: the stress may change, but it does not completely disappear. At the bedside, stress is often immediate and physical. You are moving from room to room, managing multiple patients, answering call lights, giving medications, charting, handling changes in condition, and trying to keep everything on track. There is urgency built into the work. When something happens, you respond. When something changes, you act. That pace can wear on you over time, not only mentally, but physically. Case management is different. The stress is usually less about running from one task to the next, and more about thinking ahead. You are asking questions like, what does this patient need next? What could prevent a safe discharge? Who needs to be involved? What resources are available? What barriers are we missing? For example, a patient may be medically stable, but that does not automatically mean they are ready to go home safely. They may not have transportation. They may not understand their medications. They may live alone. They may need home health, equipment, rehab, or follow-up care that has not been arranged yet. That is where case management becomes important. The role is not just about getting someone discharged. It is about helping build a plan that is realistic, safe, and connected to what the patient actually needs after they leave that setting. And this is where bedside experience becomes valuable in a new way. If you have worked at the bedside, you have probably seen what happens when the plan does not match the patient's real life. You have seen patients nod along to discharge instructions they do not fully understand. You have seen families overwhelmed by new responsibilities. You have seen patients return to the hospital because they could not get medications, did not have support at home, or missed a follow-up appointment. Those experiences teach you pattern recognition. You begin to notice where the gaps are. You begin to see what could go wrong before it happens. In case management, that kind of thinking matters. You are not only looking at the diagnosis, you are looking at the whole situation, the medical needs, the home environment, the caregiver support, the insurance requirements, the patient's understanding, and the next step in care. That is why case management can be a strong fit for nurses who naturally think ahead. Nurses who like problem solving. Nurses who are good at explaining things clearly. Nurses who can communicate with providers, families, therapists, social workers, and outside agencies without losing sight of the patient. Now, this does not mean case management is easy. You may be dealing with limited resources, difficult discharge barriers, insurance requirements, family disagreements, or timelines that do not line up neatly. You may have to make a lot of phone calls, document clearly, and communicate the same plan to several different people. But the pressure is different from bedside pressure. And for some nurses, that difference is exactly what they are looking for. The next step is learning how to translate your experience. A lot of nurses undersell themselves when they move toward non-bedside roles. They say, I only have bedside experience, but bedside experience includes much more than tasks. Instead of saying, I took care of 5 patients, you might say, I managed a high acuity patient assignment, prioritized competing needs, communicated with the interdisciplinary team, identified changes in condition, and provided patient and family education. That is the same experience, but now it is described in a way that connects to case management and other roles beyond the bedside. It also helps to study the language in job descriptions. Look for words like care coordination, discharge planning, utilization review, medical necessity, transitions of care, interdisciplinary team, prior authorization, barriers to care, and patient advocacy. Those words tell you what the role is really focused on. They also help you understand where your current experience already fits. It is also important to know that case management roles are not all the same. A hospital case manager may focus heavily on discharge planning and transitions of care. An insurance case manager may focus more on medical necessity, utilization review, or care coordination over time. A community-based case manager may work more closely with long-term resources, chronic conditions, and social needs. So when you are exploring this path, do not just look at the title. Look at the setting, the patient population, the daily responsibilities, and the type of communication the role requires. That will tell you much more than the job title alone. And here's the part I want you to remember. Wanting a different pace does not mean you care less. It may mean you are ready for a role that uses your judgment in a broader way. Bedside nursing may be where you built your foundation, but it does not have to be the only place your nursing career makes an impact. Case management is one path beyond the bedside. It is not the only path, but for many nurses, it is a practical and meaningful next step because it still centers on advocacy, safety, communication, and helping patients move through a complicated healthcare system with more support and less confusion. So take your time. Learn the options. Pay attention to what parts of nursing still energize you. Then begin learning the language of the roles that interest you. You do not have to have the entire path figured out today. You just need a clearer next step. And if case management is the path you are curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there. And if you are ready to explore the different paths inside case management, choose one of the videos on screen now. The video on the left is a deeper dive into insurance case management. The video on the right is a deeper dive into hospital case management. Start with the one that feels closest to the kind of role you are curious about.